Just got a call from the emergency department. Sounds like Gus is having a problem. Let's go find out what's going on. Dr. Nake, just got your page. What seems to be the problem?
Dr. Pandian, your patient Gus looks like he's an abdominal wall hernia. It might be incarcerated. He's in room 3.
Incarcerated abdominal wall hernia. Okay, let me go take a look.
Sounds good.
Gus, sorry to see you in the emergency department. Are you in pain? Okay, let me take a look at your belly. Well, there's that bulge. I'm gonna push on this a bit. You let me know if I bother you too much. Fortunately, I think Dr. Nake was right. You have an incarcerated hernia, Gus. We need to make sure this doesn't become strangulated. Do you know what either of those words mean? I'll take that as a no. Let's talk to an expert who can tell us more.
A hernia is nothing more than a hole. Tissue pooches through some sort of space where it should be contained. Usually in the abdomen, that's the omentum or potentially the bowel or bladder. And that can be dangerous. It's more common in men than in women, maybe 800,000 inguinal hernias in men. And then incisions, when people have operations on their abdomen, at least 100 or 200,000 will develop hernias every year in the United States. Key thing to know about is when that tissue pops through and pops back, there's no real danger. When it gets stuck, that's called incarceration. As long as it's not an important structure and we haven't lost the blood supply, that's even okay. But if we get something stuck, like my thumb is losing blood supply, that's called strangulation, and that's a dangerous problem. So if you have a bulge that's painful and causing problems, you need to seek a physician immediately.
So is there anything you can do to prevent this problem? And what should you do if you develop a bulge like Gus?
The biggest risk for a hernia is being a man. 1 in 4 men will develop a hernia in their lifetime, usually in the groin or near the belly button. If you've had an incision on the abdomen, that puts you at greater risk. Other things that cause problems: smoking, lots of coughing, constipation. That puts exertion or emphasis on the abdomen and likely to develop more hernias. If you develop a hernia, it's usually not life-threatening, but you should see a physician. Most patients get these fixed, simple outpatient surgery, safely done.
Well, Gus, sounds like this problem isn't always preventable. Let's see if we can't reduce or push this hernia back into place for you. Nurse Upram, can you give Gus some pain medicine, please? All right, Gus, I'm going to start pushing on the bulge. There, we got it. This hernia that was incarcerated now is not. We've been able to temporarily reduce it. Unfortunately, this will most likely come back, so you'll need to have this fixed definitively with an operation. Do you understand? Great. You did the right thing, Gus, by coming to the emergency department right away. Now let's see about getting you home. Thanks for watching Saving Lives with Gus, and remember, be safe, be healthy, be happy.